In this comprehensive deep dive, you'll gain expert-level knowledge about asthma with detailed information covering every aspect from disease mechanisms through cutting-edge treatment options. If you've watched our Breakthrough Asthma Guide, you're ready for this complete resource covering pathophysiology, phenotyping, diagnosis, biologic options, smart technology, precision medicine, and practical management systems. This evidence-based guide synthesizes the latest 2024 to 2025 medical research with practical guidance for complete symptom control, giving you the comprehensive toolkit for understanding and effectively managing asthma in the modern era with access to revolutionary treatments that can transform your respiratory health and quality of life. Disease progression and health impact. Without intervention, asthma typically follows a progressive inflammatory pattern that can significantly impact overall health and quality of life across multiple domains. Initially, symptoms may present as occasional coughing or mild exercise intolerance, but they often expand to affect sleep quality, physical activity participation, work productivity, and social interactions over months to years of inadequate treatment. The condition can evolve from intermittent mild symptoms to persistent moderate manifestations that influence daily functioning, including sleep disruption, exercise limitation, missed work or school days, and reduced participation in social activities. The inflammatory cascade extends beyond primary respiratory symptoms, as chronic asthma can contribute to cardiovascular stress, anxiety disorders, depression, and reduced overall fitness levels that compound the original breathing difficulties. Chronic untreated asthma increases risk for respiratory infections, pneumonia, permanent airway remodeling, and severe life-threatening exacerbations, making early comprehensive intervention crucial for preventing these additional health challenges. However, understanding progression also reveals tremendous hope for intervention at any stage. Even long-standing, poorly controlled asthma responds exceptionally well to modern biologic treatments, and the respiratory system's healing capacity allows for significant improvement regardless of symptom duration. Modern treatments can interrupt inflammatory progression and often reverse many negative impacts, restoring normal lung function and quality of life within 4-12 weeks of beginning appropriate care. Recent longitudinal studies show 85% sustained improvement rates when comprehensive precision medicine approaches are implemented with proper biologic selection and digital monitoring systems. Underlying causes and risk factors. Asthma results from a complex interplay of genetic predisposition, environmental exposures, immune system dysfunction, and airway structural factors, with no single cause responsible for development. Genetic predisposition plays a significant role, with family history of asthma, allergies, or eczema increasing risk by 25-35%. But having genetic risk factors does not guarantee developing the condition, while environmental triggers remain essential for disease expression. Immunological mechanisms, particularly involving type 2 inflammation pathways, contribute to increased asthma sensitivity through eosinophil activation, IgE antibody production, mast cell degranulation, and cytokine release, including IL-4, Illinois-5, and IL-13. Environmental factors include allergen exposure such as dust mites, pet dander, pollen, mold spores, cockroach proteins, and indoor air pollution from cooking, cleaning products, and tobacco smoke. People who have early childhood viral respiratory infections, premature birth, low birth weight, or maternal smoking exposure show increased likelihood of developing asthma. Additional risk factors encompass occupational exposures including chemicals, dusts, fumes, cleaning agents, and agricultural materials that can trigger adult-onset asthma development. Physical factors such as obesity, gastroesophageal reflux disease, hormonal changes during puberty or pregnancy, and certain medications including aspirin or beta blockers also influence development and progression. Understanding these multifaceted causes helps eliminate self-blame and emphasizes that asthma is a legitimate medical condition requiring professional treatment rather than personal weakness or lifestyle failure, while also highlighting prevention opportunities for family members and communities through environmental control measures. Comprehensive diagnosis and assessment. Professional diagnosis involves a thorough evaluation considering symptoms, medical history, family history, environmental exposures, and functional impairment across life domains using standardized assessment tools. Specialized healthcare providers use spirometry testing, peak flow monitoring, fractional exhaled nitric oxide measurement, and validated questionnaires to ensure accurate identification and rule out other conditions with similar presentations, including vocal cord dysfunction, COPD, heart failure, or anxiety disorders. The diagnostic process typically includes detailed evaluation of symptom patterns including timing, triggers, severity, response to bronchodilators, seasonal variations, and impact on sleep, exercise, work, and social activities. Physical examinations focus on respiratory function, allergic signs, and sometimes allergy testing or chest imaging to rule out structural abnormalities that can complicate asthma management. Many people feel relief during the diagnostic process because it validates their experiences and provides a clear path forward for evidence-based treatment options. Healthcare providers emphasize the collaborative nature of diagnosis, encouraging patients to openly discuss all symptoms, concerns, and treatment goals without fear of judgment or stigma about respiratory limitations. The diagnostic process also identifies asthma phenotypes such as allergic asthma, eosinophilic asthma, aspirin-exacerbated respiratory disease, or exercise-induced bronchoconstriction, which significantly affects treatment planning and biologic selection approaches. Modern diagnostic frameworks recognize the complexity of asthma presentations and focus on functional improvement rather than symptom severity alone. This comprehensive approach ensures treatment addresses all aspects of the condition and maximizes likelihood of complete symptom control and normal quality of life restoration. Strategic doctor questions for optimal treatment. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes and builds collaborative therapeutic relationships that lead to personalized care plans. Essential questions include asking about different treatment options available, expected timelines for improvement, and specific criteria for measuring progress toward complete symptom control. Treatment options. Inquiry. What treatment approaches do you recommend for my specific asthma phenotype? And what are the pros and cons of each option, including traditional inhalers versus biologic therapies? Are there newer biologic treatments or clinical trials that might be appropriate for my situation, especially if current treatments aren't providing complete control? Timeline and progress. Questions. What should I expect in terms of improvement timeline with different treatment options, and how will we measure progress toward complete symptom control? What would indicate that we need to step up to biologic therapy or change our treatment approach for better outcomes? Biologic therapy. Questions. Am I a candidate for biologic therapy such as depemokimab, dupilumab, benralizumab, or other targeted treatments? What biomarkers or tests would help determine which biologic would work best for my specific asthma pattern? Technology integration. Would smart inhaler technology, peak flow monitoring apps, or digital symptom tracking enhance my treatment effectiveness? How can we integrate digital health tools to optimize my asthma management and prevent exacerbations? Experience and approach. What is your experience treating severe or difficult to control asthma? And what is your general approach to advancing treatment when standard therapies aren't sufficient? How do you stay current with the latest asthma treatment advances, including 2024 to 2025 breakthrough therapies? Emergency planning. What warning signs would require immediate medical attention versus routine care adjustments? How can I access urgent care between appointments if needed? And would emergency benralizumab treatment be appropriate for my asthma type? Advanced medications and treatment effects. Modern asthma. Medications offer highly effective symptom control with significantly improved safety profiles compared to earlier treatments. First-line controller medications, such as inhaled corticosteroids, remain foundational treatments, typically requiring 2-4 weeks for full effectiveness while producing fewer systemic side effects than oral steroids when used appropriately with proper inhaler technique. These medications work by reducing airway inflammation, decreasing mucus production, and preventing bronchial hyperresponsiveness, with 70–80% of people achieving good symptom control. Combination inhalers containing inhaled corticosteroids plus long-acting beta agonists show enhanced benefits for moderate to severe asthma, improving both symptom control and exacerbation prevention compared to single-agent therapies. Next-generation biologic treatments target specific inflammatory pathways and are revolutionizing severe asthma care, including ultra-long-acting options that require dosing only twice yearly. Depemokimab targets IL-5 with enhanced binding affinity, allowing 6-month dosing intervals, avoiding the injection fatigue that previously deterred many patients from biologic treatment. Additional biologics may be prescribed for specific asthma phenotypes, including dupilumab for allergic asthma, benralizumab for eosinophilic asthma, and omalizumab for IgE-mediated asthma, while rapid-acting options take effect providing immediate symptom relief. Biologic effectiveness varies between individuals based on asthma phenotype and biomarker profiles, often requiring precision medicine approaches to select optimal treatments for complete symptom control. Most people experience substantial improvement within 4-8 weeks of starting appropriate biologic therapy. Side effects, when they occur, are typically mild injection site reactions that resolve quickly, including minor pain or redness that disappears within 24-48 hours of administration. Emerging treatments in 2025 include smart rescue inhalers such as Air Supra that combine bronchodilators with anti-inflammatory medications, offering dual-action relief that prevents exacerbation progression. These advanced options provide hope for complete symptom resolution and normal quality of life restoration for people with any severity of asthma. Revolutionary smart technology and digital health integrative treatment approaches combining traditional medications with evidence-based digital health technologies show enhanced effectiveness for asthma management and exacerbation prevention. Recent studies demonstrate that smart inhaler technology can improve medication adherence by 40-60%, while reducing emergency healthcare visits by identifying patterns before symptoms worsen. Smart inhaler devices provide real-time feedback on inhaler technique, medication timing, environmental triggers, and symptom patterns through smartphone integration. Digital therapeutics, including FDA-cleared apps, provide evidence-based breathing exercises, trigger identification tools, medication reminders, and healthcare provider communication platforms that support long-term asthma control. Wearable technology, including continuous respiratory monitoring, environmental sensor integration, and artificial intelligence prediction algorithms show significant benefits for proactive asthma management, particularly when combined with healthcare provider monitoring. Air quality apps and pollen forecasting provide practical tools for managing environmental triggers while building long-term environmental awareness and avoidance skills. Telemedicine and remote monitoring approaches have proven incredibly effective in providing specialized asthma care access and ongoing symptom assessment that improves treatment outcomes. These approaches recognize that optimal asthma management encompasses comprehensive environmental and lifestyle factors, not just medication compliance. The combination of traditional medications, biologic therapies, and digital health tools often produces better outcomes than any single approach alone, offering multiple pathways to complete symptom control and enhanced quality of life. Integration strategies help people customize their treatment approach based on individual preferences, lifestyle factors, and technology comfort levels while maintaining clinical effectiveness. Emergency treatment breakthrough. Benralizumab revolutionary emergency treatment research has demonstrated that benralizumab, a monoclonal antibody targeting eosinophils, provides superior outcomes compared to traditional steroid treatment during acute asthma exacerbations. The groundbreaking ABRA clinical trial showed 74% reduction in treatment failure rates when benralizumab was administered during eosinophilic asthma attacks compared to standard prednisolone therapy. This represents the first major advancement in emergency asthma treatment in over 50 years, offering hope for the 30-50% of asthma exacerbations that involve eosinophilic inflammation. Single-dose benralizumab treatment showed faster symptom resolution, reduced need for additional medical intervention, fewer hospital readmissions, and improved quality of life compared to traditional steroid courses. The treatment targets specific inflammatory pathways active during acute exacerbations, providing precision medicine approaches even in emergency settings. Healthcare providers can administer benralizumab in emergency departments, urgent care clinics, or specialized medical offices, with potential for home administration pending regulatory approval. Research demonstrates that benralizumab emergency treatment reduces the inflammatory cascade that drives severe exacerbations, potentially preventing the long-term airway damage associated with repeated severe attacks. This breakthrough offers particular hope for people with eosinophilic asthma phenotypes who frequently experience severe exacerbations despite optimal controller therapy. The safety profile of emergency benralizumab mirrors that seen in maintenance biologic therapy, with no significant adverse events reported in clinical trials. This treatment represents a paradigm shift toward personalized emergency medicine that addresses the underlying pathophysiology of individual exacerbation types rather than using one-size-fits-all approaches. Comprehensive biologic therapy. Options. Modern biologic therapies target specific inflammatory pathways involved in asthma pathophysiology, offering precision medicine approaches that can achieve complete symptom control for people with moderate to severe disease. Currently, 6 FDA-approved biologics provide different mechanisms of action for various asthma phenotypes, allowing healthcare providers to match treatments to individual patient characteristics. Omalizumab targets IgE antibodies and works best for allergic asthma with elevated total IgE levels, requiring monthly injections with 60–70% of patients achieving significant improvement. Mepolizumab and rislizumab target IL-5 cytokine and effectively treat eosinophilic asthma, reducing exacerbations by 50–60% with monthly or every 8-week dosing schedules, respectively. Benralizumab targets the IL-5 receptor for more complete eosinophil depletion and allows every 8-week dosing after initial loading, showing 70% exacerbation reduction in appropriate patients. Dupilumab blocks IL-4 and IL-13 signaling pathways and treats both allergic and eosinophilic asthma phenotypes, offering broad effectiveness with every 2-week injections. Tezepelumab represents the newest FDA-approved option, targeting TSLP, thymic stromal lymphopoietin, and showing effectiveness across multiple asthma phenotypes regardless of eosinophil count or allergic status. The ultra-long-acting depemokimab offers 6-month dosing intervals while maintaining superior efficacy, representing the future direction of convenient biologic therapy. Biomarker testing including blood eosinophil counts, fractional exhaled nitric oxide, total IgE levels, and specific IgE panels help healthcare providers select optimal biologic therapy for individual patients. Most people begin experiencing benefits within 4–8 weeks, with maximum effects achieved over 12–16 weeks of consistent treatment. The combination of biomarker-guided selection and patient preference factors, including dosing frequency, injection location, and cost considerations, allows for truly personalized biologic therapy that maximizes both effectiveness and treatment satisfaction for long-term asthma control. Precision medicine and biomarker testing. Advanced asthma care increasingly relies on precision medicine approaches that use biomarker testing to guide treatment selection and predict therapeutic responses. Biomarker-guided therapy has revolutionized asthma management by moving beyond symptom-based treatment to targeting specific inflammatory pathways active in individual patients. Blood eosinophil counts serve as key biomarkers for selecting IL-5 targeted biologics, with counts above 300 cells/ml indicating likely responsiveness to mepolizumab, rislizumab, benralizumab, or depemokimab therapy. Fractional exhaled nitric oxide, FeNO levels above 50 ppb suggest type 2 inflammation and predict responsiveness to inhaled corticosteroids and biologics targeting IL-4, IL-13 pathways. Total IgE levels and specific IgE testing identify allergic asthma phenotypes that respond well to omalizumab therapy, environmental control measures, and allergen immunotherapy. Vitamin D levels, aspirin sensitivity testing, and gastroesophageal reflux evaluation provide additional precision medicine data for comprehensive treatment planning. Sputum eosinophil analysis, when available, provides detailed information about airway inflammation patterns and helps predict responses to different anti-inflammatory treatments. Genomic testing for medication metabolism variants can guide inhaled corticosteroid selection and dosing optimization for individual patients. Advanced testing, including exhaled breath condensate analysis, bronchial thermoplasty candidacy assessment, and novel biomarker panels, continue expanding precision medicine options. The goal of biomarker-guided therapy is achieving complete symptom control with minimal medication burden through optimal treatment selection, rather than trial-and-error approaches. Healthcare providers increasingly use decision-making algorithms that incorporate multiple biomarkers, symptom patterns, exacerbation history, and patient preferences to develop truly personalized treatment plans that maximize effectiveness while minimizing side effects and treatment burden. Supporting loved ones. Effectively, supporting someone with asthma requires understanding, patience, and knowledge about effective approaches that truly help, rather than inadvertently causing harm. Listen without judgment, and avoid minimizing responses, such as, "just breathe normally," or "it's all in your head," as this invalidates their physical experience and can increase anxiety around breathing difficulties. Instead, acknowledge their breathing challenges and ask how you can best provide support during difficult moments. Learn about their specific triggers, including environmental factors, stress patterns, and activity limitations, while respecting their need for activity modifications and encouraging gradual progress rather than pushing through symptoms that could trigger exacerbations. Offer practical support like helping maintain trigger-free environments, assisting with medication organization, accompanying them to medical appointments, and learning proper inhaler techniques. Encourage professional treatment and advanced biologic options while avoiding becoming their primary medical advisor or trying to diagnose their symptoms based on internet research. Maintain your own well-being and set healthy boundaries to prevent caregiver stress, anxiety, and the tendency to become overly protective of their activities. Support groups for family members and friends of people with asthma provide valuable resources and connection with others in similar situations who understand the challenges. Celebrate improvements in breathing, activity tolerance, and quality of life, understanding that asthma management is often gradual with periods of adjustment. Specific encouragement about their commitment to treatment, recognition of their breathing improvements, and support for their activity goals help maintain hope and motivation throughout the treatment optimization journey. Economic considerations and treatment. Access understanding. The economic aspects of asthma treatment helps ensure access to optimal care while managing financial considerations effectively. Modern asthma treatments, particularly biologic therapies, represent significant financial investments but provide substantial value through reduced emergency care, improved productivity, and enhanced quality of life. Most insurance plans cover FDA-approved biologic therapies when medical necessity criteria are met, including documentation of inadequate control on standard treatments and appropriate biomarker testing. Patient assistance programs from pharmaceutical manufacturers can significantly reduce out-of-pocket costs for qualifying individuals, with some programs providing free medication for uninsured patients. Generic medications, including inhaled corticosteroids and bronchodilators, provide cost-effective foundation therapy for many people with mild to moderate asthma. Prescription assistance programs, pharmacy discount programs, and mail-order pharmacy benefits can reduce medication costs substantially for people with financial constraints. The total cost of untreated or poorly controlled asthma often exceeds the cost of optimal treatment when considering emergency department visits, hospitalizations, missed workdays, and reduced productivity. Comprehensive treatment that achieves complete symptom control typically reduces overall healthcare costs through prevention of expensive acute care. Healthcare providers can assist with insurance authorization processes, alternative medication selection when preferred treatments aren't covered, and connecting patients with financial assistance resources. Many asthma specialists have dedicated staff to help navigate insurance and financial barriers to ensure access to optimal treatment options. Preventive care, including environmental control measures, trigger avoidance education, and proper inhaler technique training, provide cost-effective approaches that enhance medication effectiveness and reduce the need for expensive rescue treatments or emergency care. Future innovations and research directions. The future of asthma treatment continues advancing toward even more personalized, convenient, and effective approaches that promise complete symptom control for all people with asthma. Gene therapy research shows promising early results for correcting underlying genetic factors that contribute to asthma development and progression. Next-generation biologics in development include ultra-long-acting formulations, requiring only yearly injections, oral biologic alternatives that eliminate injection requirements, and combination biologics targeting multiple inflammatory pathways simultaneously. Smart inhaler technology continues advancing with real-time pollution monitoring, GPS-based environmental alerts, and artificial intelligence that predicts exacerbations days before symptoms appear. Regenerative medicine approaches, including stem cell therapy and airway remodeling prevention, show potential for reversing long-term asthma complications and restoring normal lung function even in people with severe disease. Microbiome research reveals opportunities for probiotic therapies that could prevent asthma development and enhance treatment effectiveness. Personalized medicine advances include pharmacogenomic testing that optimizes medication selection based on individual genetic profiles, advanced biomarker panels that precisely identify optimal biologic therapy, and wearable technology that provides continuous respiratory monitoring and automatic medication adjustments. Environmental health improvements including indoor air quality technology, allergen reduction innovations, and climate change adaptation strategies provide population-level approaches to reducing asthma burden. Telemedicine advances continue improving access to specialized asthma care regardless of geographic location. The convergence of these innovations promises a future where asthma becomes a completely manageable condition with minimal impact on daily life, offering hope for prevention, cure, and optimal quality of life for all people affected by this common respiratory condition. Subscribe now to join thousands getting reliable health information that improves lives, as knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,